Trump health insurance rate increase. How are you all dealing with it? I think we're going to be okay. We changed some things around. We're now instead of going out to eat, we are grilling fish on an upside down shopping cart from Walmart over a burning garbage barrel. How are you dealing with the Trump increase?
Holy shit. I have been a skeptic from the beginning, but I think we're about to find out that the Democratic shutdown strategy was genius because the Washington Post just broke some news. And you're going to find out, even if you're not paying attention. But the health insurance marketplace just started showing people prices, even though open enrollment isn't available yet. What they found is because of Donald Trump, health insurance prices are set to increase by 18% this year. But that's not even close to the whole thing, because that 18% price increase doesn't include the subsidies expiring. Once you add in the cost that you're going to have to pay because Donald Trump's one big beautiful bill canceled the subsidies, the average annual cost for individual coverage is going to jump from $888 this year to $1,904 next year. That's a 114% increase in the cost of health insurance in 1 year. And
$888 to $1,904 in 1 year. That's not inflation, that's a mugging. A legal one with paperwork. And what kills me is that number doesn't care about your politics. It doesn't check your bumper stickers before it hits your bank account. Red county, blue county, doesn't matter. January 1st, the bill arrives. And the $2,500 health account being offered as the replacement, with $5,000 to $6,000 deductibles on top, bro, that math doesn't math. You're still negative thousands before you've seen a single doctor. The people who designed this system, they have government health care. For life. Just sitting there, fully covered, voting to gut yours. That detail alone should make everyone's blood boil, regardless of who you voted for.
if they find a way to preserve the subsidies, it will be exclusively because Democrats refused to let it go. And because Americans refused to buy the bullshit Republican lie that this was all about providing free health care for illegal aliens. Trump's approval rating has already plummeted into the 30s because Americans know that when the government shuts down, you should probably hold accountable the people who run the government. But that's just political accountability. What happens when Americans see that Donald Trump is demanding $230 million in grievance payments from the Department of Justice, while at the exact same time they're asked to pay 114% more for health insurance for their family than they did last year? Americans are going to realize that the Republican Party that once only cared about millionaires and then only cared about billionaires now only cares about one man.
You know, it's good that Kennedy is going after Tylenol and pregnant women because women's pain, especially pregnant women's pain, is already taken so seriously by the medical community. So women, especially pregnant women, shouldn't have so many options for pain control. I mean, it's definitely not about controlling women's bodies. This administration would never try and do that.
Oh, the sarcasm is soaking wet, and I am here for it. Going after Tylenol for pregnant women while simultaneously gutting prenatal Medicaid coverage. You really can't write this stuff. Like, we're worried about the Tylenol. But not the fact that millions of women are about to lose access to the doctor who would even prescribe something in the first place. That's rearranging chairs on the Titanic and calling it interior design. When you cut healthcare and pain management options in the same fiscal year, at some point it stops being coincidence and starts being a policy direction. Women feel that pattern before the headlines confirm it. Always have.
There was a lot of breaking news today here in the United States, and here's just like a little recap in case you missed some of it. First, the Trump administration decided today that you having clean air, it doesn't really matter anymore because the EPA had repealed the environmental findings that was founded back in 2009, which held a lot of major polluters accountable for polluting our skies. Donald Trump is calling this, quote, the single largest deregulatory action in American history, which only means that he scrapped all the climate regulations for his billionaire buddies so they don't have to pay as much into it. While for the next 30 years, we could see billions more of pollution added into our skies.
Single largest deregulatory action in American history, said like it was a flex. 15 years of clean air protections. Gone. In one signature. And the beneficiaries aren't small business owners or working families. It's the guys who wrote checks to the campaign. That's just the sentence. That's what happened. Here's the part that gets me, though. The same crowd cheering, this is the one constantly complaining about expensive asthma inhalers. Sir, the air quality and the medical bills might be connected. That's not a radical observation. That's just biology. You bought the policy. You get the pollution. The rest of us just breathe it in for free. Lucky us.
These billionaires, by the way, are the ones that gave him money up into the election. So this is sort of like one of those, hey, thanks for your help. I'm scrapping all this stuff. You're saving a lot of money. Which, let's take a poll. Will that now lead to you guys getting more money in your pockets? I didn't think so. Speaking about money, it's time to talk about the government shutdown again, because yes, for the third time in a year, we could see at least one slither of the US government shut down. This all, of course, has to deal with the Department of Homeland Security, where in the last voting to get bills passed, that was the only thing held back, because both sides wanted to figure out a way to fund this properly without rewarding DHS. Democrats are saying that they want a common sense reform of ICE before they kind of move forward with any kind of funding. Republicans oppose any of that, saying it's going to tie the hands of our agents doing their job. And well, if something doesn't get passed soon, the Homeland Security budget, that's going to be shut down. We now move over to Minneapolis, where today, after 2 months of controversy, the Trump administration is finally pulling out of Minnesota. This came from the border czar, Tom Homan, who said the operation resulted in more than 4,000 arrests. This operation, by the way, was under the name Operation Metro Surge. Now, how many of those 4,000 arrests were actually those illegally here? We don't know. Independent research shows it's probably around 3,000, but we don't see federal data, so we have to trust him, or at least take what he says with a grain of salt.
4,000 arrests, no federal data, and we're just supposed to nod? That's not accountability, that's a press release with a badge on it. And the how many were actually undocumented question isn't a small detail. That's the detail. Because if American citizens got swept up in that number, and independent research suggests the gap is real, that's not an immigration operation anymore. That's something that needs a different word entirely. Operation Metro Surge. Great name, very few receipts. Classic combo.
But the good news is that ICE is finally getting out of Minneapolis. We now move back to Washington, D.C., where a federal judge today ruled against the Pentagon trying to reduce the pension of Senator Mark Kelly and his rank. The judge said that the Pentagon had trampled Kennedy's First Amendment rights, which is valid since he's not an active service member, so he can speak his mind. And just a quick little headline for you. I don't know if you know this, but the United States went to Venezuela today. By U.S., I'm referring to the U.S. Energy Secretary Chris Wright, who met with the acting president of Venezuela. While there, he made a speech referring to a message from Donald Trump, which says he is passionately committed to absolutely transforming the relationship between the United States and Venezuela, part of a broader agenda to make the Americas great again, to bring our countries closer together, to bring commerce, peace, prosperity, jobs, and opportunity to the people of Venezuela. But that is your recap on the news, folks. Let me know what you think in the comment section below. Do me a big favor. Make sure you are actually following me. A lot of people were, and now they're not. I don't know. It's a TikTok thing here. And if you want more information, I'll have more for you in my nightly newsletter. It goes out around 11 p.m. Eastern time. The link to that's in my bio. But yeah, please do share this video and follow me for more.
We have some big news this morning. Americans are about to pay a hell of a lot more for coffee, clothing, and really everyday necessities as the tariffs have been hiked to the highest rate since the Great Depression. These tariffs are already in effect. The Trump administration has already put them in effect. You have reciprocal tariffs of 10 to 15% across the board, impacting countries across the globe. And then you have tariffs some as high as 39% for Switzerland. So Swiss coffee or Swiss chocolate going to pay a hell of a lot more. 50% for Brazil. I spoke to a local coffee manufacturer and distributor who told me that he just can't afford to be buying coffee anymore from Brazil because he's now selling it at a loss because of how expensive coffee is now coming into the United States. But the tariff rate hasn't been higher since the Great Depression, which means you're about to pay a lot more for everyday goods. And yes, this is me after paying $7 for a coffee for my wife, which is unreasonable in and of itself, but alas. Spread the word.
Selling coffee at a loss. The most universally consumed beverage on the planet. We tariffed our way into making coffee a luxury. That's a genuinely impressive achievement in the absolute worst direction. 50% tariff on Brazil, the country responsible for roughly a third of global coffee supply. Did anyone run that number before signing it? Like, did somebody look at a map? And here's the thing nobody's saying out loud. The base loves their morning coffee. That's not a political preference. That's a human need. You just made their morning routine 40% more expensive and called it patriotism. $7 for a coffee and climbing. Somebody's winning here. It's not you.
And follow along to the update on all the news you need to know about. More to come very soon.
Government shutdown and the Affordable Care Act subsidies that have been cut under Trump's big beautiful bill and the cuts to Medicaid. Okay, here's the deal. Here's the reason why the Democrats are refusing to sign the current bill proposed by Donald Trump and the Republicans. Because the bill that they want to modify. They want to add back the Affordable Care Act subsidies that are going to end December 31, 2025, if you didn't know this. If you get your health insurance, and 22 million Americans get their health insurance and have subsidies, 24 million total get it, but 22 million have subsidies. If you have a subsidy, the subsidies under Donald Trump's big, beautiful bill end December 31. The Kaiser Foundation has estimated that the average premium will go up 75%. Can you afford your health insurance premiums to go up 75%? And some may actually triple. Can you afford that? If so, you can thank Donald Trump and the Republicans, because they want you to pay more to keep your health insurance. That is making America great again. That is clearly America first, right? Helping the American people keep their insurance by raising the prices such as this. I think that's fantastic, don't you? I really do. You can thank Donald Trump. So that's why Chuck Schumer, that's why Hakeem Jeffries and the Democrats don't want to go along with it. They want these subsidies put back in to protect the American people. Instead of just cutting the taxes for the richest of the rich, they're trying to protect the average person. So if you're on MAGA and you don't want to see it, it's fine. I'm sure many of you will be the ones that lose your coverage if you can't afford to pay the increase. There you have it. Love to hear from my Democrats, my MAGAs, my crazies, my cuckoos, my Brundle bulbs. MAGA, can you ever open your eyes? Because if you can on this one, guess what? After December 31, when those health insurance premiums go up, you're going to FAFO again. Just like the farmers, just like everybody on the tariffs, just like everything else Trump has done.
FAFO is not just a meme anymore. It's a financial forecast. And what's brutal about this one is the sequence. Farmers hit first by tariffs, then manufacturers, then people on ACA subsidies, then Medicaid recipients, then SNAP. It's not random, it rolls downhill, and the bottom of the hill is where most people actually live. The farmers FAFO'd and got bailed out and still didn't connect the dots. Now it's healthcare's turn. 75% average premium increase, some tripling, and the people getting hit hardest aren't in Manhattan penthouses. They're in the exact zip codes that voted most enthusiastically for the bill that caused it. Economics doesn't do loyalty, it just does math.
Inflation's out of control. The war in Ukraine is nowhere near stopping. Same thing in Israel and Gaza, on and on and on. He's done none of the things he's promised, except throw lots of undocumented immigrants that have not committed any crimes into a prison without using their due process rights. There you have it. Love to hear from everybody.
You guys do realize that this entire situation right now with the government and Trump and the SNAP, it can all be boiled down to one sentence. Donald Trump would rather starve children than lower our healthcare costs. Don't believe me? Let me explain. Trump administration is claiming that because the government is still shut down, there are no federal funds for SNAP. And so on November 1st, all federal funding for SNAP is going to run out. But of course, we've since learned that that was a lie, that there is a contingency fund of $5 to $6 billion, which absolutely can be used to fund SNAP during November. Trump and his team are acknowledging the existence of these funds. They're just saying, oh, we can't use them. It's not legal. Even though up until 2 weeks ago, they had on the USDA website that they would access exactly these funds to pay for SNAP if the shutdown went on for a long time. Why the sudden change? Because things have changed since then. Democrats stayed united and are still holding strong for more affordable health care. Remember, the Affordable Care Act premium tax credits are expiring at the end of this year. On January 1st, healthcare premiums for everybody on the Affordable Care Act are going to explode in a way we've never seen before. And this will not just affect people who are on the ACA, although about 5 million people will lose their insurance coverage. It will affect everybody. Healthcare costs will skyrocket for everybody. So when the last budget continuing resolution ran out about 6 weeks ago, Republicans suddenly needed Democrats. They needed 7 votes in the Senate from Democrats to pass a new one. And Democrats said, not so fast. You have been unwilling to sit down and talk to us for 1 hour about what goes into this continuing resolution, but we'll tell you what we want. We want those premium tax credits extended. You just gave massive tax cuts to the richest people in the country. You're sending money to Argentina. You're spending money on ballrooms. We want to spend money on healthcare for the American people because otherwise we'll be in a crisis. And Democrats have held strong. They have held strong. They have said, even if the government shuts down, we will not fold until you pay for these premium tax extensions, which you know Americans deserve and need way more than rich people needed those tax cuts. Republicans thought Democrats would fold. They haven't.
See, this is what actual leverage looks like. Write it down. The whole playbook for years has been threaten the shutdown, watch the other side panic, win by default. It worked over and over because the fear of blame was stronger than the policy itself. And suddenly, on something that touches every American's wallet directly, the fold didn't come. Now the next move is holding SNAP hostage. Threatening kids' food to win a healthcare negotiation. That's the hand they're playing. And the fact that that's the only card left tells you everything about the strength of the underlying argument. When your only move is hurt people until they surrender, you've already lost the debate. You're just negotiating terms of the loss.
And the more Americans learn about the situation, the more they are blaming Republicans. So Republicans are like, we've got to end this. How are they going to do that? They think if they hold SNAP hostage, Democrats will finally yield. And that's why I say that it is an absolute fact that Donald Trump and Republicans would rather starve children than lower healthcare costs for working Americans. They don't even have to think about it twice. And I challenge anybody to fact check me on what I just said and prove me wrong. You can't.
All right, so here's an explosive update on the government shutdown is what I'm hearing, right? So it's not what you're being told. That's all I got to say. The headlines say it's about healthcare and rising premiums. You've heard it all, right? And then Democrats are saying that Trump wants to raise the cost of Obamacare. Well, it's not that he wants to. That's not the full picture. Here's what's actually going on. So when Obamacare, which, as you know, is the Affordable Care Act, first came in, it made health insurance mandatory. But after COVID, President Biden signed new legislation that temporarily expanded subsidies, basically tax credits, to make health insurance cheaper for Americans. Now, these weren't just discounts. And here's how it works. It's pretty scary to think about it. The Department of the Treasury sent the difference in cash directly to the insurance companies. So if your premium was, let's say, $600 a month, and the new plan lowered it to $400, the government literally paid the $200 difference straight to your insurer. That's billions of tax dollars going out every single month directly to private insurance companies. Those enhanced subsidies expire on the 31st of January or 31st of December 2025, and starting in January, that money stops. And when it stops, premiums go back up fast. Millions of Americans will suddenly see their costs go up by 20 or 30% or more. So we got to do something. So why is Washington gridlocked? Well, because those subsidies aren't just helping you. They're a cash pipeline for the insurance industry. And there it is. It's also free money for illegal health insurance. Boom, there it was. And when that pipeline closes, the insurance companies lose billions of free money. That's why the Democrats are filibustering and refusing to move forward. They're not doing it for you. They're doing it for the companies funding their re-election campaigns and the illegals who they hope will vote for them. Insurance companies, pharmaceutical giants, corporate donors, the groups that pump millions into campaign coffers every cycle is who we're talking about. They're telling the politicians, you either extend this program or we're going to fund your opponent next election. And that's exactly what's happening. The Democrats are shuffling. So the government stays shut down. The American people get held hostage, and the money keeps flowing. Not to you, but to the middlemen. So let's call it what it is. This shutdown isn't about protecting Americans. It's about protecting a cash pipeline from the U.S. Treasury straight into the private corporations and a new voter bloc for the Democrats. And until we break that loop, until citizens start leading, not career politicians protecting their donors, nothing changes.
Okay, pause, because this take sounds sharp, but it's missing something critical. Yes, insurance companies benefit from subsidies flowing to them. That's real. But here's what gets conveniently left out. Those subsidies exist because private insurance is the system. If you hate the government paying insurance companies, the logical conclusion is a public option, not cutting the subsidies and leaving 22 million people without coverage. Pulling the pipeline without replacing it doesn't stick it to the insurance industry. They're fine. They just cover fewer people and charge more to the ones who stay. The people who get hurt aren't the corporations. They're the teacher in Phoenix, the warehouse worker in Tennessee, the self-employed guy in rural Georgia. Follow the money all the way to the end. That's where the real answer lives.
That's the citizen leadership I always keep talking about. Focusing on what's real, following the money and demanding accountability, not headlines. Because the truth is simple. If you're paying the bill, then you deserve to know where your money actually goes. Wouldn't you agree?
Housing costs out of control, grocery costs out of control, electricity bills out of control, childcare costs out of control, and healthcare costs are out of control. And I didn't want to make the situation worse by burying their heads in the sand and refusing to extend the Affordable Care Act tax credits. These extremists spent all of last year promising to lower the high cost of living. In fact, they said, not us, they said they were going to lower costs on day one. And they never intended to do a thing about it. And we know now costs aren't going down in America, costs are going up.
I didn't think about this one, folks. This is kind of interesting, and it's a clip that I've got from PBS, and it talks about healthcare and how the rising cost of healthcare is going to permeate pretty much every facet of the system, thanks to, of course, Donald Trump. Now, as we know, Donald Trump just passed the big, beautiful bill, which is going to add $2.8 trillion of debt over the next 10 years in order to give the rich the tax cuts that are in that bill. So they're not going to feel this. But as you know, Medicaid is going to be cut by $900 billion. That was in the bill. There's also going to be work requirements for Medicaid. SNAP gets cut hugely. That also has work requirements. And this whole thing about work requirements, it's not like people don't work, because you have to work to live, right? I mean, you have to have some sort of income to live. They try to paint this picture that you're just sucking up the system if you're getting Medicaid or SNAP. But the reality of it is that you're just not making enough. You're not making enough for them. It's not that you're not working. You're just not making enough. So have a listen to this clip from PBS, folks.
This area of American healthcare is really among the most complex problems this country has, and it's confusing to many people. But can you help people understand, if you're not on Medicaid, maybe if you don't have a direct connection to these health programs, could this still affect you, all of these cuts?
Absolutely. The Congressional Budget Office estimates we'll see more than 7 million people uninsured compared to what we have now. And that's a significant number. And what happens when that occurs is hospitals, for example, they're still required under federal law to treat anyone who comes in their emergency room. But you're going to have more people who don't have insurance coming in. So what that's going to do is add to what they call uncompensated care. The hospitals are going to have to cover this one way or another. So what you'll see is premiums potentially rising for everybody who has private insurance or employer insurance to help make up that gap. So it definitely is going to affect everyone, regardless of whether they're on Medicaid or another federal program. This is something that's across the board. Everyone's going to feel this.
Medicaid or another federal program. Woman, this is the part that people with good employer insurance keep sleeping on. 7 million people losing coverage means 7 million more people in emergency rooms without the ability to pay. Hospitals absorb that. Then they offset it through higher rates for insured patients. Your insurance company eats higher rates, then passes it to your employer, who passes it to your premium. It's not charity, it's arithmetic. Healthcare is a system, not a solo experience. You can't blow a hole in the hull and be surprised the whole boat takes on water, even the people in first class. No exemptions, no exceptions. The math comes for everybody eventually.
So I found that as I was researching for another podcast that I'm working on, which I also have a podcast on Sirius XM. It's called All That's Left Today. I encourage you to tune in. But I'm looking at ways, folks, and you'll want to know this. I'm looking at ways to flip the script on the rich, because it's about time we stop treating Americans' benefits as privileges and all the tax benefits that rich Americans get as rights.
We know that healthcare can be confusing, right? And sometimes it feels like the people that are making the rules don't have to live with the rules that they make. So today, I'm going to break down Trump's great healthcare plan versus the ACA, which is sometimes called Obamacare. I want to do this so that you can actually understand how it affects your family, okay? The Trump's plan gives people $2,500 in cash and promises lower drug prices. That sounds good, right? But deductibles are super high, like $5,000, $6,000. And protections for pre-existing conditions, they aren't guaranteed. But meanwhile, the Affordable Care Act's cost-sharing reductions, it lowers your costs, lowers your bills when you actually go to the doctor. And that's a big difference. So that $2,500, that may sound like a lot of money. But families with prescriptions or hospital visits could pay way more out of pocket. So cheaper premiums don't always mean cheaper health care. Understanding this is key. If you want the full breakdown, real numbers, pros and cons about each plan, I've also done some charts and what this could mean for your family. Please watch the full video on my YouTube channel. I've put the link in the comments below. And remember, Proverbs 4 and 7, with all thy getting, get an understanding. Don't miss it. Hit the video link in the comments. I'll see you in the next video. God bless.
So here's the bottom line. Bad policy doesn't check your voter registration before it hits you. The premium increase lands in your mailbox regardless. The tariffs show up in your grocery receipt either way. The pollution doesn't ask who you voted for before you breathe it. That's the part that's hard to argue with, not the politics, just the numbers. And if something's starting to feel off, if the receipts aren't adding up, trust that instinct. Look at who benefits. Follow where the money actually goes. Because it's not hidden, it's just loud enough to be distracting. Drop a comment. Do you think the subsidies get saved, or is January 1st going to be the wake-up call nobody was ready for? Like it, share it with someone who needs the math explained, and subscribe because we're not done yet. See you next time.